I will go to my second case that I want to show you. So this case was actually really interesting. The lady is missing at the middle. I don't know why, but it doesn't matter. It's not important. So this patient actually came recently. She's an ancient patient of mine, but she came on during the COVID crisis. She called me because I never stopped working 100%, and she was really in crisis. So she called me and she said, "Raphael, I'm really bad. I'm almost on a nervous breakdown," because she's also a chronic. She suffers from chronic depression, and she lost her husband a couple of months ago, and she was inside her home all the time, so it doesn't help at all. And she had a lot of strong symptoms. So she, for example, she could not follow my conversation, and I could perceive that because I was trying to explain things to her, and her eyes would go like Joel, you know. So she was not listening at all. She would just say yes, yes, and lie down, and so she could not follow my reasoning. For example, she had trouble walking on the road outside and shifting directions. For example, she would be afraid to cross the street even if there were no cars, because she lacked motivation, decision, etc., etc. So she was really in a state that we could call critic. And people may think, okay, but this is for Western medicine. But actually, she is treated by Western medicine. She is followed by a psychiatrist. She takes a lot of pills, a lot of drugs, okay? But it was not helping her. So because she know me already, and like 2 or 3 times a year she comes to see me, this time she decided to come again. So I started treating her, and it was also really interesting because after, is everything okay? Okay, so I will continue. So after 2, 3 treatments, again she started to see small changes. Okay, not big ones, but she was sleeping better. She was less anxious. Okay, so things were starting to move. The chi was starting to balance again. Okay, it's always the same reasoning, the same idea. Okay, and after the sixth treatment, it was so powerful that when I was talking with her and advising her exactly to breathe in a certain way, to do somehow like qigong exercises to maintain her health, to so she could be emotionally more stable. And I was telling her the importance of trying to feel her chest, because the chest, a lot of times we feel the chest like empty or closed or tight, okay, and it's a sign of stress and anxiety. Okay, so she was a lot better, but I was telling her, you have to notice if eventually you have some sensation, because it means that you still have something, and we have to go further. And with breathing exercise, you can go deeper, even if you decide to stop acupuncture. And that at that point, she stopped me and she told me, Raphael, if you knew how I was before I started acupuncture, you wouldn't believe. So now I'm really, really a lot better. And this is a case that touched me because I know this person, and she suffers a lot of from many things. And in this case, again, in 6 treatments, someone who was on the verge of a nervous breakdown, she was completely out of the world, we can say, and she get herself together with the help with acupuncture. So this case for me, it's again an important case to remember ourselves that acupuncture can be really effective for a lot of problems, mainly also emotional problems. Okay, I'm not a specialist on psychological issues. I receive every kind of issues, but I just want to say that yes, acupuncture can treat, and I treat without herbs. Okay, sometimes, and what I do a lot of times is I recommend qigong exercises or only breathing exercises, because people like to stop really soon the treatments, either because of the money or because they want to come back, or they don't like the needles. So a lot of the times I complement my treatment with qigong exercise in these cases, and I don't use herbs. I don't. So as you see, even in complicated cases, can have a really interesting effect. So I will show you now my third and last case. In this case, this case is really interesting, again for me at least, because I followed a different approach. Okay, and this is like more classical approach. Even we can find here like some philosophical or alchemical way of thinking. So this is like a patient of mine that comes to see me 1 or 2 times a year, and only when he's really, really bad. He's like a workaholic, so he's a mechanic. He works 12 to 14 hours a day, and every time he comes to see me, he barely sleeps because of the work, and his mind is always working. So even when he lies down on the table, he's like always talking, cannot stop. So he's crazy. So the last time he came to see me, actually it's not the last time, because further on he came back for other issues, but that time he came back to see me, he was like he couldn't sleep for 2 or 3 days. And because he was like hyperactive, that's why it's written here, hyperactive male. I put 10 hours a day, but actually it's a lot more. And for me, he's like the kind of a lot of heat, a lot of fire, and his heart is completely in excess. So I thought, like, okay, this is the heart fire that it's excessive. I need to, and in Chinese medicine, we talk a lot like this with images, and we have to put some water in the heart to cool it, right? And we have the 5 elements in Chinese medicine. We have the fire that corresponds to the heart, and we have the water that corresponds to the kidney. And what I've done is, there's also many principles in Chinese medicine, but in channel theory, we have like we call the Shu Antique points, that the 5 points that are from the elbows to the tip of the fingers, and from the knees to the tip of the toes. And from that points, we can treat the whole body. And each and every point has an element within. So meaning in each and every channel, we can find the fire element, or the water element, or the wood, etc., etc. So what I've done is that I use actually a tongue acupuncture point that is not the classical Shu Antique point, but it's like an adaptation, and it worked really, really well. It's like I tried to find the water point within the heart channel, so to cool it, okay, because he was really hyperactive, he was not sleeping, so he shunned his consciousness, his mind, his emotional state was completely out of balance. So I used this point, Xinmen, that means actually the door of the heart, okay? And at the same time, I work with the water element, that it's the kidney, so the kidney channel. And in the kidney channel, I use the fire point. And the idea was, like you see in the chart here, it's like you see like it's what we call a trigram. Before Xinmen, there's like in red and blue, there's a trigram that it's called Li, or fire, and before Rangu, that it's the kidney point, there's Kan, water. So, and in the middle, okay, the lines are different from the others. So I try to like to shift, to bring the water to the heart, and bring the fire of the heart to the water. It's like even an alchemical process, and we work in Neigong and stuff like this. So the main treatment was like, for me, the strategy was to bring down the fire of the heart and heat the kidney. And so the kidney also could balance the heart and control it, actually. And then I added Ganling, it's like a Daoma to settle the liver, which controls emotions, and it can smooth chi circulation within the body. And where you see the top letters is a combo really known from Dr. Tan to also to treat anxiety issues, stress, and it's Yin Tang, Ye, Shenman, and Anmian. So, and after only one treatment, that was like, whoa, complete success. It's he slept for the next days without any issue. So his mind completely became normal only with this treatment. So that's why I brought this case. First of all, because it's completely different mindset from the others. My strategy was different. I used a different approach, and also because I think it was really effective.